Um, so I want to get started. Karen, did you want to introduce yourself first and what your role is here, and then I'll introduce myself, and then we'll get right into it.
Yes, absolutely. Hi, everyone. I'm
Thank you.
Karen. I'm Karen Scanlon. I work with the mindfulness group in recruitment and administration, and I will be helping Bill with the chat today.
All right. Thank you, Karen. And I am Bill McCracken, and I am a certified teacher in mindfulness-based stress reduction. I'm also a qualified teacher in mindfulness-based cognitive therapy. I teach the mindfulness-based cognitive therapy program for Brown, as well as the foundations course for Brown, which is the first training course for people that are interested in going along the teacher pathway, which we'll talk a little bit about today. Um, so I've been doing this practice for about 30 years, and I am in private practice with my own clinical practice where I serve clients in Delaware and Maryland. And that is through psychotherapy, but also through some mindfulness programming as well. So that's my background. Really lovely to see all of you. The first thing that I want to ask is, are you all here for exploring the teacher pathway for mindfulness-based cognitive therapy? Or maybe there's some other people here that are just interested in mindfulness-based cognitive therapy overall. So maybe a show of hands, how many people are here with an interest in the pathway, the teacher pathway? Okay. So just pretty much anyone here just to learn about mindfulness-based cognitive therapy itself? Okay. All right. Well, welcome everyone. So what I'd like to do to get things started is I'm going to share just a really brief PowerPoint with all of you because it'll just give you a sense of what the program is and the background, and I'll look at some of the training pathways too. So give me one moment to share that with me. You're going to see my other desktop for just a minute. This way I can have both monitors open. Okay, so you should be able to see that. Can someone just give me a thumbs up that you can see that full screen? Thank you, Juliana. Appreciate that. All right. So I gave a little bit about my background. So the overview of what we're doing today is to just get a sense of what the mindfulness-based cognitive therapy program is, what some of the benefits are, and then also a look at the training pathway. So that will really be our main agenda, is the overview. We'll take a look at some of the benefits and risks in MBCT, and then we'll also do the training pathway. And then we'll have some time at the end to open up for questions and answers, because I'm sure that some of you will have some questions about this, because I'm just basically touching on some really general pieces here. So if we look at mindfulness-based cognitive therapy as a program, it was developed by Zindel Siegel, Mark Williams, and John Teasdale. And Zindel Siegel works with us here at Brown when he can, which is really, really amazing because he is one of the founders of this program. So if we look at the origins, this was a program that really started to get off the ground in the late 90s, and it was developed by the three people that I mentioned. And the goal here in MBCT is to prevent relapse in people with recurrent depression. And this has to do with combining cognitive therapy principles, cognitive theory, and mindfulness practices. Um, it is adapted from the core practices and the structure of the 8-week MBSR program that John Kabat-Zinn developed. What's interesting, though, is that the developers of MBCT were not interested at first in developing a mindfulness course. That's not what this was. The research was being done around relapses that were happening with mood states like depression in particular. And through the research, they began to find that traditional cognitive behavioral therapy works really, really good for people initially when they're in treatment, but in relapse, it wasn't working as well. So they were looking for another way to do this. And when they investigated some strategies, they came across the 8-week program of John Kabat-Zinn and started to look into that and develop the program out of that. So it really is a program that blends these two things together. And it is a mindfulness-based intervention because it is based on the 8-week curriculum. So there's been about 40 years of research that shows the effectiveness of MBSR. And now there's about 30 years of research that shows the effectiveness of mindfulness-based cognitive therapy. So if we look at kind of how this developed over time, um, the kind of the key insight here in the training is to train awareness of thoughts and feelings so that we can help people disengage from automatic thoughts, negative thinking patterns that we see triggering depression. But also, we're noticing as well that this works just as well for um, states of anxiety, too. So it's not just for depression. So the first program was published in the Mindful Way, oh, I'm sorry, the Mindfulness-Based Cognitive Therapy for Depression. And it's really widely used by clinicians in the field, and it's really the manual for the MBCT program. So as I was saying, it's adapted from MBSR for recurrent depression, but now we also recognize anxiety and distress. It's just as effective there too. So it's combining mindfulness training and cognitive therapy principles. And the goal is to help people see their thinking patterns, to help recognize mood states. Um, and it allows people to recognize some of the subtle pieces of the mood states that they may otherwise have overlooked, rather than reacting automatically, which can be the first link in the chain of moving down the relapse path. So really, MBCT is designed to help people navigate those mood states. So if we look at how mindfulness-based cognitive therapy helps, um, it's really a process of recognizing the early signs of when the mood is coming on and the mood is starting to decline. And the program really has a focus on shifting from critical thinking mode to present moment experiencing. So that was one of the things in the research that was shown that traditional CBT, although very good when the person first comes into treatment, it wasn't so good when people were having subsequent relapses, because in traditional CBT, people are thinking critically about their thoughts. They're going through what's called dysfunctional thoughts and filling out dysfunctional thought records. And the research was showing that actually this was increasing rumination and thoughts of worry. So the mindfulness approach is present moment experiencing of what's happening, body sensations, thoughts, emotions, and the impulses to act. So over the 8-week period in MBCT, we're looking at all of these things, and each week has its own theme that is building layers of scaffolding so that by the time the person has done the 8-week program, especially during the last two classes, there's a way to put together a relapse prevention plan. There's a way to investigate behaviors and activities that are nourishing rather than depleting, which, those depleting activities often lead to relapse again. So just some ideas here of some risks and challenges that may come up. I mean, with any kind of program, especially when you're doing an 8-week program, intense feelings or discomfort and emotions may come up. And what we're typically doing is we're meeting with people before they start the 8-week program and we're screening to see if it's a good fit. And in my experience in teaching the class, most everyone is typically a good fit. There have been situations where myself and the person who's thinking about taking the course have decided that maybe it's not the best fit at this time. Maybe they want to go and do a little bit more counseling, process some things. But it doesn't mean that we're closing the door that they can never join. But that doesn't typically happen. That's not the norm. But these initial meetup sessions before the class starts is really crucial so that the person can get to know the teacher can get to know the person, and then, work through any questions and potential problems that may come up in the course and how that can be managed. So those kinds of risks and challenges are looked at ahead of time. And some of these risks are not just the emotional stuff, but it's the physical things that could come up too. And we always invite people to practice within the bounds of their own limits. So they don't have to do everything the way that we're doing things in class. People can modify things to their own needs. The daily home practice is something that happens in between each class. So there's 8 weeks of class time, and then in between each of those classes, the person is expected to do some daily home practice, which could be anywhere from 30 to possibly 45 minutes. So that is explained up front, and it can be a challenge to people. Although, again, people are invited to modify things as they feel they need. But the importance is that we're building a foundation in those 8 weeks, so we encourage people to practice as much as they can. And the other thing is, too, is that oftentimes people come into not just an MBCT program or an MBSR program. People come into therapy with these same expectations too, of needing a quick fix. And, we're explaining to people that mindfulness-based cognitive therapy isn't a quick fix. It is something that spans over the 8-week duration as well as into their lives after the course is completed. So the benefits are just what we've discovered is there's greater well-being, resilience, a sense of choice. I mean, that's really what's important. And we emphasize that over and over again in the 8-week program that people have agency to decide what they need to do. The difference is in reactivity, people typically act very quickly and they often act in ways that they're not aware of until there's already some behavior unfolding. Whereas in mindfulness, we investigate and we explore what's going on in the body with the thoughts, with the emotions before we decide to act. And then, if action is necessary, the person has agency to act in the way that they feel is best for them. So it's different than escaping and avoiding, which tends to be more on the reactive side of things. We also know that people that take these courses have reduced stress, anxiety, depression symptoms, and they have an improved focus and self-care and the coping mechanisms and how to put those things into play tends to increase when we're taking these courses. The other thing too is there's a supportive group environment. There's a lot of things that happen in a supportive group environment, but one of the things that I think is really rises to the surface in the MBCT program is that it normalizes what it's like to be in those mood states. One of the things we do in one of the classes, typically in the fourth and fifth classes, we look at the thought patterns that happen when we're in depressive mood states and the thought patterns that happen when we're in anxious mood states. And people scan through these lists of thought patterns and recognize that these are the kinds of thoughts that I have when this comes up. And then other people will say that they have the same thoughts. And so it normalizes this for people, and they feel that there is a way to work with these things, that it doesn't pathologize them by having these thoughts and having these mood states. So the overall benefits uh, you can see here are better relationships with pain, illness, life challenges, managing mood states, and so on, right? So now I want to get into the teacher training pathway. And what I'm going to do is I'm just going to go through what's here on this slide, and then I'm going to stop sharing my slide because I want to open up for some questions that you might all have. And then I can bring up the slides again because I have the trajectory for the qualified teacher and the trajectory for the full certification. And once you see that, those things will make sense. But our MBCT teacher pathway is a 3-step process that has 5 courses, and then there's a final review at the end for full certification. But in order to teach MBCT, you do not need to be fully certified. There is a qualification stage along the way where you can become qualified to teach the 8-week program. And some people stop there because the work that they're doing in the field, that's enough for them. Other people want to go on and get further training, which leads to certification. So with personal practice as a prerequisite, there's a requirement of 2 years of daily meditation practice. There's also a requirement of a graduate degree, a mental health degree, healthcare degree, education degree. And there's also a requirement that there's some training in cognitive behavioral therapy in order to be able to kind of balance all these moving parts together in the MBCT curriculum. But I will say that some of these things are things where we could meet with people individually and discuss what kind of individual backgrounds they have, because we have made some exceptions around some of these things, depending on what your background is, what the work is that you're doing in the field. So it's not like this is very rigid. There is some flexibility there for people. So the other thing is that everyone has to complete an 8-week MBCT course if you're going to move into the training pathway. And I remember when I was looking into this, I was fully certified as an MBSR teacher, and I'm thinking, okay, I know a lot about MBCT. Why do I have to take an MBCT course, right? But I'm glad that I did. It was helpful to me as an individual, and it was also really helpful to begin seeing the clear differences between MBCT and MBSR. Um, so you have to take that course before you move into the training pathway. And you may have already taken one.